Hello, my name is Kristen and I will be talking to you today about the 4 preferred methods of how to quit smoking. Smoking is one of the leading causes of death in the United States today. More deaths are caused by tobacco use than any other deaths known, such as HIV, illegal drug use, alcohol, motor vehicle injuries, and suicide. Today I'm just going to talk about the 4 preferred methods of quitting just to inform you of which is the best way to stop. Just so you know, tobacco is the leading preventable cause of death in the United States. We're going to go over symptoms of smoking, deaths from smoking, and the 4 preferred methods of quitting. To start off, we'll talk about the symptoms. Most usually the smoker's cough is the first thing you pick up on when you talk about a smoker. You'll notice just a raspy voice and just a hard cough when they do cough, just a dry cough. It comes from the amount of tar in the cigarettes that does collect on the lungs. Next, you will notice the yellowing of teeth, fingers, and fingernails. This comes from the amount of nicotine in the tobacco that you are using, and it's the extra amount of nicotine just rubbing off on your skin or your teeth. Also, you'll notice a shortness of breath when either walking or going upstairs, and it's also from tar and smoke going into your lungs. After these symptoms have persisted for so long, the body does seem to reject them, which causes your body to no longer break it down and pretty much die. Some of the deaths from smoking are lung disease, cancer, and you can also, as in cancers, mouth, throat, lung, tongue, cancers. You can also acquire pneumonia, bronchitis, and influenza through these, which are also very deadly to you if they cannot be treated or stopped in time. There's also a lot of deaths that come from smoking. There is roughly 500,000 people who die each year from smoke and secondhand smoke. 50,000 of those are from secondhand smoke, from just sitting around someone else who does smoke. So just keep that in mind. Over half, almost 2/3 of that is from men smoking. Women usually tend to not smoke as much as you would see a man. I'm thinking ways to prevent smoking is just through 4 methods, which will just help you to stop and hopefully stop premature death. Behavioral modification therapy medicine is 5% succession rate. That you will see right here in the blue is the 5%. That is just the doctors prescribing you Zoban or Chantix, which is basically just a medicine that helps reduce the need for the nicotine. Second, you have a nicotine replacement therapy, which is about 41%, and those consist of patch, gum, inhaler, sprays, and lozenges. These can be bought at a drugstore, and they are just forms of nicotine without the use of tobacco. Third, you could use a group or a program to help you stop smoking, which is a therapist. That's also right here. They just help you get through your cravings and see what triggers them, so that way you don't have to go through that all the time. And fourth would be no method. It's just cold turkey. You just flat out stop. You just lay it down, walk away, and you try not to think about it, look at it, so that way you don't start again. I hope I have informed you of the dangers and the ways to prevent premature death from smoking and even secondhand smoke. If you have any questions, let me know. Most of my information was found from the Centers of Disease and Prevention. Thank you.